So hi everybody, welcome to Torc Talk, and of course our focus for the month of November is men's health, Movember, and delighted today to be chatting with Dr. Tadgh Curran of Ross Medical Practice. And today Dr. Tadgh Curran is taking on the headline medical conversation of prostate health.
Thanks very much.
So before we get into that, Dr. Tadgh, can you just tell us a bit about your work and your involvement in men's health in a general practice?
So as a GP, and particularly as a male GP, I would see a lot of men's health. Really, I suppose it's a very, particularly around prostate, it's a very common issue. Roughly speaking, I would think probably about 1 in 3 men, particularly over the age of 50, would run into some degree of issue with their prostate over life. So very, very common for us, something we see on a daily basis.
Okay, and just going back a bit, just relative to Movember, as it's called, where that focus is on men's health through the month of November, do you think it's important for men in general, in all aspects of their health? I suppose we're not the best at coming forward when there's issues on the range of health issues that might be there, but how do you feel Movember does as a focus point then for bringing men to see their GP or to talk about the issues that might be going on?
I think it's very useful. I think men we often try and soldier on with things, and I think it's very important just to check in on your own body and see if there is something amiss, and really just to try and get some help on it. And I think the thing to realize is that as GPs we're dealing with these sort of issues all the time, and coming and having a chat with your doctor can be very useful. Even just as a sounding board, just to see where you're at,
Yeah.
and if there's any particular issues, we delve into.
Yeah, and you've seen it all before.
That's it. It's part of our daily work, day to day. We're very used to dealing with these things.
Yeah. So for an individual man, it's all new and self-consuming, but for you, it's common practice, obviously.
Yeah, I know it can be intimidating coming to see the doctor for some people, but I think the thing is that we're very used to dealing with these things, and we have a number of tests or a lot of things can be done with your GP very quickly, either just to reassure you, or if there is an issue to deal with it. And I think the main thing is just coming to the doctor and presenting.
And just relative to men coming to GPs or seeking medical support or advice and things like that, do you think we've gotten better in recent times, that men are more open to coming and talking to their GPs or checking in even on their mental health and things like that? Are we becoming more open to that?
I think we're getting there in some respects, but I think we still have a little way to go. Really, I think often I would find that men in particular might come in and they might have a number of issues which need to be dealt with all at once. Whereas I think it's probably better to deal with things as they come up and try and get them sorted.
Okay, so no banking the issues, come in one by one with the issues and get them sorted.
So and I think that lends itself to having more time to deal with each individual issues.
Okay, so coming back to the headline topic, of prostate health. So I suppose, let's be honest, as soon as we mention the word prostate, I think men think of 3 things. Mm-hmm. They think of a rubber glove, Vaseline, and a very awkward moment.
Yeah, I suppose the thing is that is only part of it, really, and that's only I think getting a prostate exam is something that I agree with you, men probably worry about, but I think the thing to look at it is that it's for us a very normal part of an assessment, which only takes really a minute to do, and doesn't generally cause any pain. It's something that's very routine for us to check, and I think but it is nonetheless a very important part of the assessment.
Sure.
And I think the thing is that I can very readily reassure a patient if we've done the exam that nothing's wrong.
Yeah.
So I think though it might be intimidating, it's something that's very worthwhile, and the patient can get good reassurance from.
Okay. So if we go back to the basics just around prostate health, what exactly is the prostate and what role does it play in men's health?
So the prostate is a walnut-sized gland which sits just below your bladder. It's part of your reproductive system, so it contributes to part of forming semen, but I suppose the issues arise then as the prostate might get inflamed or enlarged. Like I was mentioning, particularly in men over 50, the most common thing we would see would be difficulty with passing urine. If the prostate gets enlarged, it can basically squeeze down on the tube that leads from the bladder that urine passes through, and that can lead to difficulties urinating. That might be difficulty starting when you're peeing, or a weak stream, or dribbling at the end, or indeed getting up at night time. And I suppose the issue there is that the bladder might not be fully emptying because the prostate's getting enlarged and squeezing down on that tube.
Okay, and a very simple question, I suppose, probably the wrong question, meaning that there probably is the wrong answer for this, but like it's obviously an active gland within the body system, but it's not like an appendix where it can just be taken out at a certain point in time and then eradicate the problem, or is that too invasive and too draconian?
Yes, I suppose if you were prostate surgery is only reserved really for very serious kind of cancer cases, really. So,
Okay.
and thankfully, I suppose a lot of treatments have evolved that it's not necessary to go down the line of prostate surgery straight away for a lot of cancer cases nowadays that can be treated with either radiotherapy or hormone therapy. So, because it sits very deep as well, I suppose it's something that's quite invasive if it needs to be done.
Okay, and can you tell us maybe like at what age should men be considering prostate health, meaning getting checked and things like that? And how common is it? How common is it as an issue within whatever age profile it affects?
I would say from 50 on, it would be very useful to get prostate checks, particularly your prostate-specific antigen blood test. So, which is a very simple blood test we do here, but it can give us
rubber gloves there.
no rubber gloves involved, nothing like that. Thankfully, it's just a straightforward blood test you would get along with your routine bloods, and should, I think, ideally be done every 2 or 3 years, maybe in most men. Certain groups should have it done more often, I would think, particularly those with a family history of prostate cancer. Early regular screening is very useful, as we would always consider men with a father or grandfather who had prostate cancer to be at high risk, and or brother indeed. So we should check those with the family history more often. And from our perspective, we have a guide to see what the normal expected result would be for your age, and we can keep an eye on it.
Okay. And are there any myths or misconceptions around prostate health? Is there anything that people come up with that makes men fearful of the blood test or the more physical examination? But are there any myths or anything that we need to dispel? Or
I think the thing is that a lot of men, though it is very common, men will see it as a normal part of aging, that, I'm getting urinary symptoms now, that's just a normal part of aging, whereas it's not really. I suppose that if you're having issues with your waterworks, that might be worth checking in with your GP in that case. And it is just the case in the first instance of discussing the problem with your GP and getting the blood test, and then we can make a decision if an examination is needed or not. But in the vast majority of cases, we can do all the initial screening in your GP, and we can give you an idea as to whether we're worried or not.
Okay, and you just mentioned waterworks, and obviously the waterworks is that the primary symptom to look for, meaning that's the early warning signs to say that something might be missed there if the waterworks aren't as they should be.
Yeah,
that's the main.
Yeah, those difficulties passing urine would be the primary symptoms that we look at. There can be a few other things, I suppose, that if you're getting particularly a lot of pain in your pelvis, back pain, or if you're getting more sinister or worrying symptoms like losing weight, loss of your appetite, or getting kind of sweats at night, those sort of things, in conjunction with getting those urinary symptoms, those would be a little more this would be more concerning, to be honest, and should be presented to the GP a bit more urgent.
Okay. And I suppose, to draw a very simple analogy from a man's perspective, if the kitchen tap wasn't working right, we'd probably call a plumber.
Your plumber is out and at
the same time, if our own plumbing is misfiring, sometimes we probably soldier on in avoidance of maybe what we perceive to be a difficult examination protocol. Yeah. Okay, so can you tell us then maybe how effective early detection is, and have the treatments improved outcomes for men that have prostate difficulties?
I suppose the thing to highlight here is what's going on, because I suppose the treatment varies on the underlying issue. For a lot of men, it will just be enlargement of the prostate. Particularly as we get older, that is a very common issue. There are medications, and in these cases, we would do a blood test on examination. We likely will not find any particular cause for concern that your blood test might be in the expected normal value for your age. Your examinations might show an enlarged prostate without anything otherwise amiss, and then we can give some medications here. We have a couple of medications in particular which can help shrink the bladder or shrink the prostate and allow you to empty your bladder a little more easily. It will improve your urinary symptoms, and it can be something that improves quality of life, particularly for men. They might find that they're disturbed at night, getting up to pass urine frequently through the night, and they can be very tired, and that can be wearing. So starting these medications for what we call benign prostate hyperplasia would be, or BPH would be, very effective and can improve quality of life quite quickly. The other group then, I suppose, or the more worrying group would be the patients who we worry about prostate cancer. We pick up on, in these cases, you might pick up on an abnormal examination where the prostate is in a normal shape, or the blood test might be higher than we are happy with here. And in those cases, we'd need to refer on to a specialist, and they might do further tests then, things like an MRI of the prostate, an extra scan, or they might take a biopsy sample to further assess it and see if there is an underlying prostate cancer as an issue.
I can feel myself squirming in the seat there at the biopsy.
Yeah, and again, thankfully, I suppose that they're using other things now, like MRI, to just see what patients do need a biopsy or not, rather than going straight for that. So, I mean, they're very they take a lot of consideration before they go to that.
So some precaution.
Yeah.
In case if we need it, but not
exactly.
Not necessarily so. Yeah.
If these things are being done, it's only if they're
reassurance for us all there, men. We'll be looked after. So look, beyond screening, what can men do to support their good prostate health? Is diet and exercise, habits and things like that. Is there anything that can enhance that
I think a general healthy approach to life is the main thing there. I suppose regular exercise, particularly aiming for the recommended kind of 30 minutes 5 times a week of aerobic exercise, cutting down on alcohol. Guidelines would say not more than 17 standard drinks for men per week. I would think probably even less than that if we can, to be honest.
Sure.
And then I suppose a balanced diet for prostate health. I think a good kind of, it's often described as a Mediterranean style diet, but basically plenty of fruit and vegetables and limiting the amount of animal-based products, things like meat and dairy. I suppose just having a balanced, what we might all consider a healthy diet,
Okay.
And less processed or kind of.
Okay. And does stress and mental health, or do they have any links with the physical health, including prostate issues? Would that be something that people need to mind, or does it have any impact directly, or is it just a combination factor?
One can contribute to the other. I suppose if you're having a lot of issues with your prostate or your workworks, I think that can certainly be something that affects men's mental health. Like I was mentioning, it can disturb your sleep, and being exhausted and feeling miserable from these symptoms can definitely have a negative impact. So I think addressing it early again can help that. I think to a certain extent, being stressed can certainly have a negative impact on urinary symptoms. That some men can have a sensitive bladder, where you can get more pronounced urinary symptoms if you are under stress. But again, kind of, I think that's kind of a chicken egg scenario where both one can lead to the other in both cases.
Sure. So just in a general sense, again, I know we spoke just before we started filming, we spoke about the fair sex, the ladies in our lives who are really good, come to the doctors, they're not fearful of what I would perceive to be somewhat invasive checks and treatments as well, sometimes as well. So what do you think in a general sense, meeting male patients on a regular basis, what is wrong with us that we hesitate in coming to seek advice and help on problems? What's delaying us in coming? Are we lacking bravery on a medical front, or what is it?
I wouldn't say bravery. I think any men have no problem when they do come in going through all the necessary assessments, but I think it's just life tends to be busy, and it's just a matter of, again, checking in and seeing how you are and listening to your body, and if not to dismiss. Sometimes I think we think we're, we think we just need to get on with things, but sometimes, for your long-term health, it's better just to pause, see if something's wrong, and if your body's telling you something's not right, not just to seek the help, because I think the help is out there, and things are always improving in terms of healthcare for these issues, and that we can definitely help out if we just take the time to.
Okay, great. And for those who might be worried but haven't yet gone for a checkup, what would you say to them today for this video?
I think just pick up the phone, give a ring to your local GP. We're always very happy to deal with any of these issues, and I think that just to be reassured that this is a very routine thing that we're doing all the time for patients, and that in a matter of 10 minutes we can get through a lot of these and sort things out, and in the long run that you will feel the benefit of it. We'll be able to address them and maybe make you feel a bit better in the long term.
Okay, great. Dr. Tadgh, thank you so much for talking with us today. We're delighted that you're part of the talks for Movember, and we hope that this video resonates with men, that has demystified some areas around prostate health, and that they're open to maybe coming to see you and other GPs when the need arises. But thank you so much for your time today.
Thanks.
We really appreciate it.
My pleasure. Thank you.